The Centers for Disease Control and Prevention, or CDC, has issued a serious warning. Measles, a disease once nearly eliminated, is making a comeback. The CDC's concern is growing as case numbers rise sharply. This is a critical public health message for today, May 31, 2025. The CDC is urging caution and updated its travel guidance significantly. The agency now urges unvaccinated Americans to consider postponing their trip. This change reflects the increased risk of measles spreading. The potential for exposure is higher than it has been in years. The number of measles cases in the United States is alarming. So far in 2025, we have seen 1,088 reported cases nationwide. Tragically, this resurgence has already claimed lives. 2 unvaccinated young girls have died from measles this year. Each case represents a potential chain of transmission. The virus is spreading within communities across the country. Just this week, on Wednesday, May 28, 2025, the CDC published a vital update. It clearly states that travelers can catch measles in many settings. Understanding this threat is the first step to protecting ourselves. Measles is an incredibly contagious viral illness. It spreads very easily from person to person. If one person has it, up to 90% of the people close to that person who are not immune will also become infected. The virus responsible is a member of the paramyxovirus family. It primarily infects the respiratory system. Then it can spread throughout the body. The virus travels through the air with remarkable ease. When an infected person coughs or sneezes, they release tiny droplets. These droplets contain the measles virus and can linger. They can remain infectious in the air for up to 2 hours. This airborne nature makes it difficult to control without high vaccination rates. The initial symptoms of measles can be deceptive. They often resemble a common cold or flu at first. These can include a high fever, often over 104 degrees Fahrenheit or 40 degrees Celsius. A persistent cough is also a common early sign. The telltale measles rash usually appears a few days after the initial symptoms. Recognizing these signs early is crucial for seeking care and preventing further spread. Travel environments, unfortunately, can be perfect breeding grounds for measles. The CDC has confirmed instances of measles spreading during air travel. This often happens when infected individuals are seated near susceptible passengers. Airplanes, with their recirculated air and close proximity of passengers, pose a challenge. The virus can spread efficiently in such confined spaces. Even short flights can become opportunities for transmission. The numbers this year paint a concerning picture for travelers. As of May 2025, the CDC has received 62 reports. These reports concern travelers infected with measles. This includes those flying into or within the United States. Each infected traveler can potentially spark a new outbreak upon arrival. A recent incident further illustrates this airborne threat. 3 passengers on a Turkish Airlines flight tested positive for measles. This flight was heading to Denver International Airport. One of these infected individuals was an adult who had been vaccinated. While vaccines are highly effective, no vaccine is 100% perfect. Such incidents trigger extensive contact tracing efforts by health officials. A significant number of adults in the U.S. may not be protected against measles. Current estimates suggest that approximately 10% of U.S. adults lack immunity. This translates to around 25 million people across the country. These individuals are at risk of contracting and spreading the virus. Some were never vaccinated as children. Others may have had only 1 dose when 2 are recommended. Immunity can also wane over time for a small percentage of people. The potential risks are simply too high to ignore this widespread vulnerability. Measles is often underestimated, but it can be a very serious illness. It is far more than just a simple rash and fever. Complications are common and can be severe, even life-threatening. These can affect various organ systems in the body. The risk of complications is higher in certain groups. These include young children, pregnant women, and immunocompromised individuals. However, even healthy adults can experience serious problems. Young, unvaccinated children are particularly vulnerable to severe measles. About 1 in every 20 children who get measles develops pneumonia. Pneumonia is the most common cause of death from measles in young children. Ear infections are also common, occurring in about 1 out of 10 children with measles. These can sometimes lead to permanent hearing loss. Diarrhea is another frequent complication reported in children. One of the most feared complications of measles is encephalitis. This is an inflammation of the brain, a swelling that can be deadly. About 1 out of every 1,000 children who get measles will develop encephalitis. Tragically, the current measles outbreaks in 2025 have already led to fatalities. The suffering caused by these complications is entirely preventable through vaccination. The cornerstone of measles prevention is vaccination. The CDC's message on this is unequivocal and consistent. The MMR vaccine is safe and highly effective. 2 doses of the MMR vaccine are about 97% effective at preventing measles. 1 dose is about 93% effective. This high level of protection is crucial for both individuals and communities. Achieving and maintaining high vaccination rates creates herd immunity. This protects those who cannot be vaccinated, like very young infants or people with certain medical conditions. The CDC has specific recommendations for all U.S. travelers. Before any international travel, individuals should ensure they are fully vaccinated. This means having documented evidence of 2 doses of the MMR vaccine. This guidance applies regardless of the destination country. Measles is circulating in many parts of the world. International travel inherently increases the risk of exposure. Taking this step is a critical measure to protect your health. It also prevents bringing measles back into the United States. Healthcare providers play a vital role in this prevention strategy. The CDC advises all doctors and healthcare professionals to be vigilant. Their proactive efforts can save lives and prevent outbreaks. While measles is a national concern, some areas are experiencing more intense outbreaks. 90% of confirmed measles cases in the U.S. this year are linked to domestic outbreaks. This means the virus is actively spreading within our own communities. It is not solely an issue of importation from other countries. This highlights the presence of under-vaccinated populations within the U.S. These pockets of low immunity allow measles to take hold and spread. Understanding this dynamic is crucial for targeted public health responses. One state currently facing a significant measles challenge is Texas. Over 700 measles infections have been reported in Texas so far in 2025. This high number has prompted specific recommendations from the CDC. Doctors are now advised to consider giving additional measles vaccines. This advice applies to domestic travelers who are going to Texas. The situation in Texas underscores how quickly measles can spread. The CDC is actively monitoring these hotspots and issuing alerts. On March 7, 2025, the agency issued a Health Alert Network advisory. This advisory specifically addressed expanding measles outbreaks. It highlighted particular concerns in Texas and New Mexico. The focus on domestic outbreaks means we must all be vigilant. Staying informed about local measles activity is important for everyone. If you are planning any travel, preparation is absolutely key. The first and most important step is to consult your healthcare provider. Do this well in advance of your planned departure date. Discuss your travel plans, whether domestic or international. Your doctor can review your vaccination records. They can determine if you are adequately protected against measles. This consultation is an essential part of responsible travel. During your medical consultation, focus on your MMR vaccination status. Ensure you have documentation of 2 doses of the MMR vaccine. If you are unsure or cannot find your records, talk to your doctor. They may recommend a blood test to check for immunity. Alternatively, they might advise you to get vaccinated or revaccinated. It is generally safe to receive an MMR vaccine dose, even if you have been vaccinated before. If travel to a known measles outbreak area is unavoidable, be extra cautious. Practice good hygiene, such as frequent hand washing. Try to avoid crowded places where possible. After you return from your travels, remain vigilant for symptoms. Prompt action can protect others in your community. The fight against measles is not just an individual responsibility. It is a collective effort that requires community-wide participation. Public health recommendations are our strongest tools in this battle. Following this guidance protects not only ourselves but also the most vulnerable among us. This includes infants too young for their first vaccine dose. It also includes individuals with weakened immune systems who cannot be vaccinated. Our actions have a direct impact on their safety and well-being. This concept of community immunity or herd immunity is vital. State and local health departments are on the front lines. They play a critical role in detecting and responding to measles cases. The CDC advises these departments to report suspected cases immediately. They must conduct active surveillance to identify outbreaks quickly. Rapid case investigation and contact tracing are essential to limit spread. Enhancing outreach to under-vaccinated communities is another key strategy. Health departments are tasked with this important educational work. It involves addressing concerns and misinformation about vaccines. Building trust and open communication are fundamental to this effort. Sharing accurate information about measles and vaccines is powerful. Together we can ensure a healthy